infrastructure which has actually taken a lifetime to create by Dr. Mishra. Uh, we started two systems, the electronic COVID care system and the electronic OPD system during the COVID times. And of course, the School of Telemedicine and Biomedical Informatics, SGPGI, was the principal, played a very, very important role in actually helping us out. So let me talk about the electronic COVID care system and the electronic OPD activities of SGPGI during the COVID system. So this was the COVID care system, which if you go to the telemedicine second floor, this still exists and the entire infrastructure still exists. So if there is a third wave, we can immediately go and actually start working again. I hope it doesn't happen. So how did the electronic COVID care system service start at SGPGI? So the government during the COVID system, initially we did not have any input. There was no medical input and nobody knew how COVID would be treated and how we could actually communicate with all the doctors in the periphery. So the government of Uttar Pradesh decided to start the electronic COVID care system services, and our director, Dr. Dhiman and Dr. Mishra, they actually planned the whole thing. So initially the electronic COVID care system services started with 4 specialists, and they included medical, surgical, intensive care, and other departments, and so preclinical department. This was started on the second floor of the building here, the School of Telecommunication, Telemedicine. And this consisted of 2 shifts of 6 hours duty in which the calls were received from both patients and doctors. And then from 25th of July, we realized that the OPD, we cannot have an open OPD system in which hundreds and thousands of patients are coming to SGPGI, especially in the middle of COVID. So then we started the electronic OPD system, and this merged with the electronic COVID care system from the 25th of July 2020. And this facilitated a direct access to clinical departments. And of course, as soon as that happened, the electronic COVID care system, which was a centralized facility, the number of calls went on dropping because the electronic OPD system of SGPGI took over the management of both COVID care as well as the specialized services which SGPGI was offering to the patients in the periphery. So the main aim of the electronic COVID care supports network was to provide teleconsulting services and remote clinical decision support throughout the state of Uttar Pradesh to doctors, and also to provide teleconsulting services to patients who contacted the electronic COVID care telemedicine network. So it was both in SGPGI, it was both a patient to patient as well as doctor to patient to doctor communication system which we established here. And what were the categories of patients who actually benefited from the system? One, the patients who had frank COVID infection, who developed severe illness like multi-organ failure or individual organ failure, for example, cardiac, respiratory, kidney diseases, acute neurological, or even patients who were difficult to ventilate, and several other issues. And the important thing here was that during the initial period, nobody knew how to actually treat COVID, and so there was a continuous interaction with the periphery and the center, and this really helped in formulating a policy which subsequently really helped in mitigating the effects of COVID-19 infection in the state of Uttar Pradesh. The second was symptomatic patients who were suspected to be having symptoms of COVID-19 infection, but were not sure of further progression of disease. So at that time, people did not know whether to upscale or downscale the life support, or what the preventive measures were to make sure that medical errors were mitigated. So this was very, very important. And so this continuous interaction on a daily basis really helped in securing proper treatment for our patients and in formulating policies which has still being distributed on a national level and on the state level. Then a very important subset was patients with other non-COVID-19 medical and surgical emergencies who were not able to come to tertiary care hospitals due to travel restrictions in place. And not only were these patients who were not non-COVID patients who required SGPGI medical and surgical care, but even today, the policies that we established at that time are continuing, and several of our patients are still being managed on a telemedicine basis by individual departments. And then there were patients with non-COVID ailments with significant symptoms who were being managed by doctors in peripheral hospitals who did not have sufficient expertise in treating the particular ailment, and therefore either required advice or required these patients to come to SGPGI for management. And finally, doctors and other healthcare workers working at level 1 to 3 hospitals who were managing patients with COVID-19, non-COVID-19 diseases. And whenever they wanted any kind of advice, they could immediately communicate with any department of SGPGI and actually get advice from level 1 to 3 hospitals to SGPGI. So this was a spoke and wheel model. And this was for most of the levels, level 1 to 3 hospitals, this was a doctor-to-doctor link. So from a primary health care provider, so from there to community health center, and then to district hospitals. So this was level 1 hospitals. And then, so they could communicate either with each other or with the tertiary care hospitals. Then there was secondary healthcare providers at 52 medical colleges of Uttar Pradesh. These were level 2 hospitals, and they could actually communicate with all the tertiary care hospitals. And finally, the important link was also private hospitals where both COVID and non-COVID services had started, and they also were regarded as level 2 hospitals. So this reporting was by telemedicine and other telecommunication facilities like telephone, email, fax, WhatsApp, for videos and Zoom conferencing. And this was actually a doctor-to-doctor link, which then communicated with 6 medical institutions where telemedicine facilities were available. King George Medical University, Lucknow, Medical College, Meerut, Medical College, Prayagraj, Medical College, Kanpur, and Banaras Hindu University, Varanasi. And finally, SGPGI, Lucknow. So these were regarded as level 3 hospitals. And then finally, we had an augmented electronic COVID care system hub, where both doctor-to-doctor link and patient-to-doctor link was provided by SGPGI, telemedicine center. So this worked very well, and all the centers communicated with each other all through COVID care facility. So at our center, 4 faculty members were electronically present to process the calls and they were from medical specialty, surgical specialty, intensive care specialty, and paraclinical specialties. And there were 2 shifts, one from 8 a.m. to 2:30 p.m. and the second was from 2 p.m. to 8:30 p.m., Monday to Sunday, all days. And all the faculty members of the institute rotated during these shifts. And this was apart from the COVID care health, management of patients, which was being done on a rotational basis by all faculty members of SGPGI. So the entire thing required a huge infrastructure, and this was actually facilitated to a large extent by the Telemedicine Center, our School of Telemedicine, because all the facilities were already existing. All we had to do was to connect them to all peripheral hospitals and make sure that there were people to receive the calls as well as to disseminate proper advice to our patients. So there were landlines, there were WhatsApp and Zoom dedicated facilities, email, fax numbers, and this was exhibited also on the SGPGI landline. And of course, the duty roster was created on by a centralized committee of SGPGI, and this was done on a rotational basis. The most important benefit which SGPGI got from it were 2. First of all, we did not expose our junior colleagues as well as our nursing personnel to OPD, and yet the patients got benefited because of the healthcare facilities which we could provide through this electronic care, COVID care system, and also through the eOPD system. But there is another very important thing which happened during this time. We suddenly realized the importance of video conferencing facility even during the non-COVID times. And most of the departments are still continuing this facility, and this has really, really helped our patients. So many of our patients don't even have to come for follow-up, and they can, through WhatsApp or through telecommunication landline, they can actually communicate with us, and we realized the importance of this important facility. And at the telemedicine, we could actually, there was a central mic here, and with this electronic system, we could actually communicate, and we had continuous throughout the day, phones kept ringing, and we could then communicate with the individual departments, and the individual departments gave the feedback, and this was again communicated with the patients at different points everywhere. And so you can imagine the district. So we had distribution of district, the Western Uttar Pradesh region we had with Meerut Medical College and with SGPGI Lucknow, Bundelkhand region with Kanpur Medical College and with KGMU Lucknow, the Eastern region with the Prayagraj, Allahabad Prayagraj Medical College and Banaras Hindu University, and the Lucknow district region with KGMU Lucknow, and these were the link facilities which were available. And so all consultations took place between two medical doctors at both ends. And telephone and the internet-based telemedicine system were the main backbone for the remote care delivery. Besides audio conference, patient data exchange and video conference were carried out using WhatsApp and other forms of social media tools like Zoom. Photographs of radiology and investigations were conveyed by these telephone and internet-based tools to the patients stationed at referral centers. And a photo transmitting software was also installed to transmit photographs rapidly. And the telemedicine center under Professor S.K. Mishra addressed any issues related to the electronic COVID care system network. So what was the nature of calls? What were the type of actions that could be taken for the patients? So we could take calls seeking expert opinion, management of patients, COVID-related management, ventilator care. And in case the query was related to an area beyond the domain of expertise of the people sitting there, then the people were communicating with the liaison officer in each department. And this liaison officer again recommunicated with the patient who had actually made the call and gave the answer to the patient. And in case it was a situation which could not be handled at the periphery, then a situation and circumstances were created in SGPGI to make sure that the patient came here, did a COVID test, and then we could actually manage these patients. And an investigation of radiology was conveyed to the telemedicine center, and this was given to the radiologist, who again communicated back the diagnosis to the patient. And the team of 4 doctors asked the patient to phone up directly, or this team of doctors established a communication with the experts in SGPGI with the situation at the periphery. And of course, referral to an appropriate higher level of medical college was also recommended at certain times. Now, if the patient's immediate health problems required him to come to SGPGI holding area, then an admission was done here, COVID test was done, and then the patient was admitted to the ward, and nearly 100 patients were operated on a monthly basis all through the COVID times. The emergency cases were actually done. And so this was very, very useful for all the patients there. And not only that, every day to the DGME office, we provided data related to the date, session, central registration number, of the patient, then the name of the person making the call, as well as the mobile number. This record was maintained, the city from which the call was being made, the name of the patient, a brief history of his complaints, and any examination performed by the treating doctor at the periphery, overall impression about the patient's diagnosis. Is it the follow-up patient or a new patient? What were the investigations which were sent? And this has been now still stored and continuously being used by various departments. The treatment and advice given, the referral steps taken from other departments with the name of the consultant involved, and the steps undertaken to resolve the issue, they were continuously sent to the DGME office, which kept a centralized record from all the hub and spoke hospitals of the state. They were all being maintained. And you can just to give you an idea about the day-wise statistics, you can see that the electronic COVID care system, every day we received so many calls. And then this gradually dropped, because what happened was that once we started the specialized electronic OPD system, where each department could actually take up this activity, then of course we still continued the electronic COVID care system, but then the calls to the electronic COVID care system started dropping, and the individual department calls went on increasing to the extent that a lot of facilities could be done. So this was the monthly facility. Still 300 to 400 calls were actually being managed. And then during the COVID time, from the very, very serious patients, say 14 to 16 patients were being managed and operated. 24 departments then started providing specialized services in the School of Telemedicine. And this were they were all given special rooms, and they were given computer facilities, they were given all telephone facilities. And then they started delivering their own specialized services to patients. Like you can see here, this is different departments. And then we also had, a few computer operators who were actually collecting electronic data on a daily basis. And this was being, submitted. And so you can see that month-wise, the eCCS decreased, but the month-wise cases in electronic OPD went on to almost 10,000 cases that we saw. And in all, this is only in 3 months we could cater to almost 40,000 patients from all over the state and all over the country. And apart from that, we also started other e-learning activities. So we started Tele Education administrative sessions, where various departments were frequently connecting with each other and with other hospitals of the country like AIIMS, PGI, and NIMHANS and other hospitals. And we had conducted 129 sessions and 80 medical lectures related to COVID and non-COVID areas were recorded and edited, and some of them are still available online in SGPGI. Then some doctors were also communicating with doctors at the periphery, and this is at the general hospital, where generalized services, physician, pediatrician, all of them, an orthopedic surgeon, general surgeon are available. So this was one of the sessions which was being organized. We also started doing a clinical grand round. What we have in SGPGI is that every Saturday morning, we have a teleconferencing session where the entire institute kind of participates, where each department gives either a statistics of the one project, or it gives some mortality, morbidity is being discussed. And so this was also started during the COVID times. For College of Nursing and College of Biotechnology, we started several classes, and nearly 756 classes were being taken. And not only that, for those people who are actually going for COVID duty to the Rajdhani COVID hospital, how to don and doff their special dress, and many other training programs were conducted during this time. Then we have medical video lectures, which are archived, edited, and uploaded at the NMCN portal. And there are multiple subscribers, more than 500 videos are available. And this is linked with PGI, AIIMS, and other things. And live streaming is also possible. So multiple lectures are still available, and you can still utilize these facility, which we developed during the COVID times. And then every day evening, from 6 o'clock till 8 o'clock, all the patients who were admitted in the COVID hospitals, the director, Professor Mishra, and Dr. R.K. Singh, who was the coordinator for COVID as the head of emergency medicine departments, and all those people who were actually posted in the COVID areas, they all got together and discussed each and every case who was admitted there, in the ICU, non-ICU cases, all the admissions, and this was actually being organized through this telecommunication systems. And then we also conducted examination through this. So PDCC, MS, and MCH examination was being conducted using telemedicine, and it is still being conducted and parallel. And this is done at the School of Telemedicine. And we have been successfully giving results based on these examinations. And so we have conducted several exams for several hours in a day, which have been conducted there. So to summarize the information regarding telemedicine and e-learning services during COVID-19 at SGPGI Lucknow, we conducted Tele Education and administrative sessions, which were undertaken by the School of Telemedicine and Biomedical Informatics. And these are using cloud-enabled facility. And then e-learning classes were undertaken for College of Medical Technology by School of Telemedicine, e-learning classes undertaken by School of Nursing. The SGPGI Medical Video Library was updated, and this has been uploaded on the NMCM portal and channel, and this can be accessed by everybody. Then technical assistance was given for training of healthcare workers, staff, virtual ICU rounds, and OPD was being done, and Rajdhani COVID Hospital was also being managed. And the patients were benefited through the telecare services of electronic COVID care system and an electronic OPD system of 26 specialty departments of SGPGI, and a lot of emergency patients were managed all through the COVID area using the telemedicine system. And a special thanks to Dr. Mishra for organizing everything in SGPGI. Thank you so much for your